Show are solely those of the hosts and their guests and not those of W4CY Radio, its employees, or affiliates. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. No liability, explicit or implied, shall be extended to W4CY Radio, its employees, or affiliates. Any questions or comments should be directed to those show hosts. Thank you for choosing W4CY Radio.
Welcome to the Ask the Expert show on W4CY Radio and Talk4 TV, where we bring you educational information from top local experts in the fields of legal, health, financial, and home improvement. Now sit back and listen to experts in family law, association law, hearing loss, business brokers, home care, along with many other topics. Now here are your hosts, Steve-O and Sophia.
Hey, good afternoon, Dallas, Fort Worth. Welcome to another Ask the Expert show, where we bring you the top experts in the field of legal, health, financial, and home improvement. This is the last Wednesday of the month, and that means we have the wonderful, we love her, Dr. Gamboa of Elite Care Clinic. We're so excited about having her. And I got to tell you, we received so many of your letters. I know I'm not going to be able to get them all in today. Good afternoon, Dr. Gamboa.
Hey, Steve. Thank you so much. How are you?
I'm fine. But Dr. Gamboa, people love you. They think, first of all, they all say she is so sweet, but she's so smart. Well, yeah, she's a doctor. Of course she's smart. But we, for some reason, since your last show, we got so many questions in. But before we go to them, tell people about your practice.
Sure, Steve. I'm a family medicine doctor. I have a private practice, a solo practice in the Las Colinas area. It's Elite Care Clinic. And I treat a more like functional medicine because I treat the whole person. I do personalized care, and I take care of, yes, primary care issues, but also weight loss. I do hormone replacement therapy. I do nowadays, I'm doing a little bit more aesthetics. So I do a little bit of everything, but I always thinking about the patient as a whole and always trying to find the root of the problem and treating them individually.
Hey, Dr. Gamboa, I bet you don't just sit down with somebody for 5 minutes and send them on their way. I bet that's not the kind of doctor you are.
Yeah, unfortunately, I'm always behind schedule, and that's because of that,
I knew you would be. I knew it. I knew.
It's a lot of things sometimes. I mean, honestly, I try to take care of most of the things and the patients come, and it's very hard. I don't have that. I don't know how to say it, but I cannot just tell the patient, you know what, I can only talk about one thing today, and then you have to come back later. It's very difficult,
Yeah.
and I understand some patients see their doctor sometimes once a year, especially the ones that they come for primary care. But also it's very difficult for me as a doctor to address every single one in an efficient and also a good way, because I want to give good care to the patient. So if I have to take care of 10 things, then I'm not going to be as great as doing the 10 things versus doing 2, So that's why we try to stabilize my patients and take care of them. So every time it's not as, they don't have as many chronic problems, so it's little by little, and we take care of different things. And also for example, with the hormones, I cannot give you everything all at once. We have to do it slowly, it's like little layers, we have to be layers of treatment. So little by little we have to do, because also a patient, they're going to remember 10% if I told them after I see them, but also they're not going to, if I give them 10 things to do at once, they're not going to do it. They're going to be okay, let's do it. It's a step, baby steps, especially also with food. I cannot tell the patient, stop eating everything you do, and then you have to completely 360 change for everything. They cannot. I mean, if we can do one change at a time, great. If let's say the one thing that we can do is stop drinking sodas, then yes, like one thing at a time, one change at a time. It's very difficult as humans to deal with change also, and as the
Oh,
older we
yes.
get, it's worse.
It, Dr. Gamble, I want you to know this because you don't see the letters that we get here. I, People really appreciate you giving your time during a busy day, and you're a sole practitioner. And I just want you to know how much people and myself appreciate the time you give to educate everybody.
Thank you. Yes, because that's I think the key, education. Like if people know how their medications work, how they are going to get help from them or the benefit, or like if they change their eating, if they start doing healthy things, healthy choices, how much better they're going to be, they're more likely to do it. But if they don't see results, they're like, oh, this medication is giving me side effects, and then they give me another medication to treat the side effect from the first medication. Of course they're not going to do, and they're going to be disappointed at everything, and they're not going to want to do anything, and they're not going to want to go to the doctor. So like I
Yeah.
really enjoy like education, because I really believe on that, and not only for patients but also for physicians, because a lot of physicians also they kind of stop like learning, and they only want to do what they known. And but it's, you have to evolve with everything, like with technology. If we just keep writing things on paper and not doing like what we need to do, it's, we have to keep up with everything. I think that's the key, keep learning.
One of our long time, who's been with me for about 7 years, does functional medicine in Atlanta, and he went to Emory, which was a great medical school, and he said there were so many things that we learned in medical school. I am learning so much more since I've gotten out of school and done my internship, and I am moving my practice to more functional medicine, longevity. And he said there's just so many things that they didn't teach him in medical school.
Yeah, that's so true, like, and I'm glad that finally some baby steps are being given towards like nutrition, for
Yeah,
example, nutrition in the medical schools, nutrition in medicine, because sometimes they think that we know everything and we don't, like we didn't get those like specific like training on nutrition, how much protein you need, how much you need to do this, all these things that we don't learn really like in medical school, so now like
exactly.
hopefully like it's going to get better. But yeah, it's so true, so many things that we have to learn afterwards, because I guess whenever you're doing your training, your even your in your residency, you only learn the most common things. You learn what you're going to be seeing, like how to save lives, the basic stuff. But then if you want to do more like specialized things like hormones and things like that, you have to look on your own and to see all these experts that they've been doing this all this, and they've been learning also by experience, by doing stuff and seeing what works, what doesn't work, and then you learn from those experts, but you keep learning. I think that's the key for everything.
Well, he started off, he was an OBGYN doctor. And the
Yeah.
more he learned about hormones and longevity, he moved his practice completely over to that. But let me get started with the questions because we've got so many people who've written you. I'm going to start off with Grace in Fort
Okay.
Worth. She says, "Hi, Dr. Gamboa. I never missed one of your shows.
Thank you,
How,
Grace.
how do I improve my metabolism for faster weight loss?" That's a good question.
Yeah, that's a great question. Like first of all, I would like to know like of course the age, like so if we are in the
Yeah,
menopause age, then that we are at a little disadvantage there, because the estrogen, the testosterone, they help us with visceral fat, they help us with our metabolic rate, they help us with everything, right? With muscle mass. But also we have to think about the thyroid. So our thyroid is like the director of the orchestra, so to speak, and that's the one that is going to determine our metabolism. So if you're having some issues with your thyroid, or even if you're not, but they didn't check your functional portion of your thyroid, then it could be a problem that it's in the lower side. So iron can interfere with the production or the conversion of the T4 and T3. T3 is the one that is going to help you with the part of your metabolic rate. Muscle mass is going to help you with your metabolic rate. So little things that they can do to improve your metabolic rate. But definitely we have to look at your hormones, we have to look at your thyroid.
Kimberly and Irving says, Dr. Gamboa, I have the hardest time falling asleep. Any suggestions? I know we need enhanced sleep quality for mental clarity.
Oh yes, that is huge, because like I'm glad that you brought that up, because also, why it's so important that beauty sleep is not only just like a myth or like a cliche, right? So like the beauty sleep is very important, because while we sleep, the lymphatic system goes in there. It's like the cleaning crew. So it goes and takes out all the toxins, all the what the cells like used and everything, and they remove all that, and then so that you can have like more clarity in the morning. So whenever you don't have enough sleep, then that's not enough time for that cleaning crew to remove all those toxins and cell debris, like, and you get foggy. So the problem with sleep is, number one, are you having a lot of stress in the day? Because if you're having a lot of stress or having a stressful job, then during the day you're having a lot of cortisol levels. So like at night you're still wired. So you're not able
Yes.
to, our brain is not like an off and on switch. You cannot just turn it off and say, okay, go to sleep. No, you're still like with all that like hormones with our cortisol, and you're all wired up. So that's one thing. Another thing is that if you're eating too late at night, and that's also like
Mm,
something that is not good, and it's going to interfere with your sleep. If you snore, we have to make sure that you don't have sleep apnea. Sometimes
right.
if your iron levels are too low, like you have what we call restless leg syndrome, I'm sorry, and then it gives you sleepless nights. And because you move a lot, you're not able to feel comfortable. So many ways that you can like look into like your sleeping, and of course the hormones. Whenever your testosterone levels are low, then you start having night sweats on top of like the estrogen levels being down. So, and you're not able to sleep. Whenever your progesterone levels are low, the progesterone is like a hormone that helps with anxiety, like it relaxes you, it helps you, and it makes you sleepy. So many things that we can look into to help you. But in the meantime, you can probably look into doing some valerian, some magnesium, to like kind of help you relax a little bit, trying to go into like a very good sleep schedule. Because if one day you sleep at 10, another day you sleep at 1, another day at 8, your cycle, your circadian cycle is going to be all messed up. So you have to be having a good schedule, not having a lot of like blue light before going to sleep, like the electronics or any kind of like stimulation to your brain. But we have to look into all these other things to help you sleep.
I know you deal a lot in weight loss, and you talk about stress, and those two kind of go together, don't they? I mean, you see patients that are have a lot of stress and they're gaining weight. How do
Oh,
you
definitely.
treat the stress?
Definitely, Steve. Like the problem is a vicious circle. As I was telling you, you have a lot of stress. Guess what's the stress hormone? Cortisol. The cortisol is our basic, it's our friend whenever we need the flight or fight like thing, and we need to like get from like a dangerous situation. And also we need it because it keeps our blood pressure and everything running. But at the same time, too much of it causes a lot of problems, because like it can increase our blood pressure, it can increase our insulin resistance. So like, and then it doesn't help us sleep. So how do we help this? Of course, like we can do a lot of like techniques of like breathing techniques, the box breathing that we talked about before. We can also like do some yoga, some like exercise, everything of that,
Meditation.
meditation for sure. Like it can help you. But also like we have to recur to some like supplements. And the supplement that I really like, it's called Relora, that comes from the magnolia plant. And this one has shown in some studies that they decrease in a natural way the levels of
Over
cortisol.
the counter?
It's a supplement, yes. We have
Good.
it here in our office. Like I didn't see similar concentrations like on Amazon or anything. Like although like probably there are some, but we have it here. And so that one is you do it twice a day, and that helps tremendously, little by little, decreasing your cortisol levels. Because also, the more cortisol levels you go, guess what's going to increase your cravings? And then you start eating, stress eating. because also the increase on the dopamine after you eat, it's the happy hormone. So like then you feel a little better. So it's a vicious circle. And then you don't sleep well, your cortisol goes up, your hunger hormone goes up. So everything is related. So we need to control that in different ways, attack it from different angles, basically.
Is there a supplement for cortisol?
Just like the what I was telling you, like the one from like a supplement from the magnolia, the relora,
Hmm.
that decreases your production in a natural way of the cortisol. So little by little.
Anne in Arlington. Thank you, Dr. Gamboa, for giving your time each month on the Ask the Expert show. I just want you to know how much I appreciate you. See, that's I
Yeah.
told you. Uh, can you talk on improper gut health and digestion uh, for decreased bloating and discomfort? I have such a problem with bloating and uh, and digestion.
Well, and thank you so much for bringing this up. I appreciate it also because this is so important. And this is also part, again, functional medicine from inside out, right? So we have to help you like be functioning properly and also with trying to find the root of the problem. So what I want you to do is like, have you heard of probiotics? So probiotics are so big now because now we know more about how the microbiome in the gut, the bacteria in our gut, is the importance of it. You know, like how important they are for our life. You know, because like the microbiome like takes care of not only the lining of your gut, because nowadays we know that if there's not a good lining, then all the antigens, all the toxins, all the viruses, they go through really fast through your circulation, and that's whenever they're going to cause a reaction with your immune system. So that's why we have so many more allergies. There are so many other problems. We get sick very often, you know, or we have all these digestive issues because we're not having the proper bacteria to help digest all these foods. So I would recommend for you to avoid as much as possible like unnecessary antibiotics. Try to, if you're taking some like uh, proton pump inhibitors, meaning anti-acid medications, that we have to decrease it, but don't decrease it cold turkey because then you're going to have severe heartburn. So we have to do it slowly if you have been taking them for a long time. But the most important thing is for you to start changing some of your eating habits. Try to avoid eating a lot of processed food, a lot of foods that they have a lot of this artificial dyes or like any other artificial things and processed, you know, because that is going to destroy your lining and your microbiome, and you're going to have problems. The other thing is to make sure you don't have a bacteria called H. pylori, which causes a lot of gastritis. You know, it can cause a lot of bloating, a lot of heartburn. So if we checked everything, we made sure that there's not gastritis, there's no problems in your colon, that you went to the gastroenterologist, they checked you, they did a colonoscopy, endoscopy, everything, and everything is okay, and you keep having problems, most likely you have IBS, irritable bowel syndrome. This comes along with stress, going back to stress. Everything is stress related. So like with stress, then it attacks your like muscles in your gut. It causes spasms, it causes diarrhea, it causes like bloating, it causes like constipation, cramping. So it's very uncomfortable. So what you can do in the meantime, like yes, controlling your stress, replace replete your good bacteria in your gut. Probiotics, 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 and then also for now try to avoid like some like um, dairy products until you're feeling better, and follow a low FODMAP diet. A low FODMAP diet is whenever like you can look it up online, it's very common. So basically it's going to give you a list of foods that are going to have less fermentation. They're going to make less gas whenever they're going to be digested. So there's going to be less discomfort that you have. But I think we need to look at all these other options or possibilities that I told you. But the first thing is please take probiotics.
Gene and Richardson. This is another good one. Dr. Gamboa, you are treating my best friend. She adores you.
Oh, thank
I'm
you.
so glad you're doing a talk show. Um, can you talk about relieving symptoms of hormonal imbalances? I'm 55 years old, female. Is it because of my age?
So, like, thank you for the kind words. So, yes, whenever we're 55, most likely you are already in menopause. So, whenever you're menopause, that means your ovaries are no longer making estrogen or testosterone, and your levels went down. So, whenever this happens, then you're going to have like this imbalance because your body's going to sense it. It's going to be like, hey, where's my where's my estrogen? And estrogen plays a huge role in the brain and the heart, like to like protect our heart, like protect against cardiovascular disease, protect against dementia. The same thing as the testosterone. It gives us like it has receptors in our skin, in our brain, in our bone, in our heart. So it helps with everything. Why do you think that a lot of women after menopause we want to go crazy? Because like everything is not working as it used to. You have joint pain, you have fatigue, you have like brain fog, all the things that the only way to like help you is, of course, like there's not a powerful like prescription more powerful than healthy eating habits and exercise, like healthy eating habits. But also, of course, like there's no other thing that is going to help you by replacing your hormones with estrogen, testosterone, and progesterone if you're able to have them.
Well, I got to tell you, we always talk about how fast your show goes. We're actually replaying Dr. Gamboa's show now twice a month, and she's going to be with us again next month. I am so sorry we couldn't get to all the letters, but it just is enough for next month. Dr. Gamboa, tell people, I know you have a website that they can go to.
Yes. Thank you, Steve. I know whenever we're having fun, the time flies, right?
I know. I know.
The website is www.elitecare-clinic.com, and I am a solo practitioner in Las Colinas, Elite Care Clinic.
Well, you're taking all the pressure off me because people adore you. I'm
Oh,
just your
thank you.
sidekick now. I'm your co-pilot now. Anyway, Dr. Gamboa, thank you so much. You always give us such great information, and
Thank you, Steve. I'm
tell
happy to give
we
you all
love
this
you, and tell
information.
Harold hello for us.
I will. Thank you so much.
Thank
Thank
you.
you, everyone. Thank you.
That's Dr. Daniela Gamboa. She's in the Dallas Fort Worth area. She's with us every month. She is amazing. That's going to do it for us today. Thank you, Rebel. I love her. I love Rebel. We'll see you all next week with more Ask the Experts.
Thanks for tuning in today to the Ask the Expert show on W4CY Radio and Talk4 TV. Tune in next week and every week to hear more from our experts on personal injury, insurance, air condition repairs, estate planning, Medicare, and many other topics in the areas of legal, health, financial, and home improvement. See you next week.